Hello everyone, and welcome back to the channel. Today, we're discussing a topic that is incredibly important for everyone to understand. Strokes. It's a serious medical condition, but knowing what to do can make all the difference. So, let's get right into it. What exactly is a stroke? Imagine your brain as a bustling city that needs a constant supply of energy to function. This energy comes from oxygen and nutrients, delivered by your blood. A stroke happens when this vital blood supply to part of your brain is suddenly blocked or reduced. When that happens, brain cells are starved of oxygen and nutrients, and within minutes, they can begin to die. This is why a stroke is a true medical emergency where every single second counts. There are two main types of strokes, and it's helpful to understand the difference. The most common type, accounting for about 85% of all cases, is called an ischemic stroke. Think of it like a plumbing blockage. A blood clot forms in an artery leading to the brain, or travels to the brain from elsewhere in the body, creating a dam that stops blood flow. The second type is a hemorrhagic stroke, which makes up the remaining 15%. This is more like a pipe bursting. A blood vessel inside the brain leaks or ruptures, causing bleeding into the surrounding brain tissue. This bleeding creates pressure on brain cells and damages them. Both types are extremely dangerous and require immediate medical attention. So, how can you spot a stroke? There's a simple and powerful acronym to remember. FAST. This is crucial information that could help you save a life. F is for face. Ask the person to smile. Does one side of their face droop or look uneven? That's a major warning sign. A is for arms. Ask the person to raise both arms. Does one arm drift downward, or are they unable to raise one arm at all? This indicates weakness on one side of the body. S is for no más. Ask the person to repeat a simple sentence, like the sky is blue. Is their speech slurred, strange, or are they unable to speak at all? Are they having trouble understanding you? And finally, T is for time. If you see any of these signs, it's time to call for emergency help immediately. Don't wait. Don't try to drive the person yourself. Call an ambulance so medical personnel can begin life-saving treatment on the way to the hospital. Besides the fast signs, there are other symptoms to be aware of. A sudden, severe headache that feels like the worst headache of your life can be a sign of a hemorrhagic stroke. Other symptoms include sudden dizziness, a loss of balance or coordination, sudden trouble seeing in one or both eyes, or sudden paralysis or numbness on one side of the body. If any of these happen out of the blue, treat it as an emergency. Now, let's talk about what happens at the hospital. The treatment depends entirely on the type of stroke. For an ischemic stroke, the one caused by a clot, the main goal is to restore blood flow as quickly as possible. There is a critical window for treatment, typically within 3 to 4.5 hours from when the symptoms first started. The primary treatment is a powerful clot-busting medicine called TPA, which stands for Tissue Plasminogen Activator. It's given through an IV, and works by dissolving the blood clot, which restores blood flow to the brain. This medication can significantly reduce the long-term effects of a stroke and improve the chances of a full recovery. In some cases, especially if the clot is very large or if the TPA isn't effective, doctors might perform a procedure called a mechanical thrombectomy. Here, a surgeon threads a tiny catheter through an artery, usually in the groin, all the way up to the brain. They then use a special device to physically grab and remove the clot. This procedure has been a game changer for treating severe strokes. For a hemorrhagic stroke, the bleeding type, the goals are different. The immediate priority is to stop the bleeding and reduce the pressure building up inside the skull. Doctors will work to control the person's blood pressure using medication, as high blood pressure can worsen the bleeding. In some situations, surgery might be necessary. This could involve clipping a ruptured aneurysm a week, bulging spot on an artery wall, or removing a pool of blood to relieve pressure on the brain. After the emergency phase is over, the journey of recovery begins. This is where a team of healthcare professionals and a lot of patients come into play. A stroke can affect many abilities, so rehabilitation is tailored to the individual's needs. Physiotherapy is essential for regaining muscle strength, coordination, and balance. A physiotherapist helps patients with exercises to strengthen weak limbs and relearn how to walk and move safely. If the stroke affected the part of the brain responsible for language, speech therapy is vital. A speech-language pathologist can help patients relearn how to speak, understand language, read, and write. Occupational therapy focuses on helping stroke survivors relearn the skills needed for daily living. This could be anything from getting dressed and cooking a meal to using a computer. The goal is to help the person regain as much independence as possible. We also can't forget the emotional impact. It's very common for stroke survivors to experience feelings of frustration, anxiety, and depression. Emotional support through counseling or support groups is a crucial part of recovery, not just for the survivor but for their family as well. Of course, the best-case scenario is to prevent a stroke from ever happening. The good news is that up to 80% of strokes are preventable by managing risk factors. Let's go through the most important prevention strategies. First, control your blood pressure. High blood pressure is the single biggest risk factor for stroke. Work with your doctor to keep it in a healthy range, which might involve lifestyle changes and medication. Next, manage your cholesterol and blood sugar. High cholesterol can lead to plaque buildup in your arteries, and diabetes increases your risk of stroke. Again, diet, exercise, and prescribed medication are key. If you smoke, stopping is one of the best things you can do for your health. Smoking damages your blood vessels and significantly raises your stroke risk. Also, limit your alcohol intake. Maintaining a healthy weight through a balanced diet and regular exercise is also critical. Aim for at least 30 minutes of moderate activity most days of the week. Focus on a diet that is low in salt and unhealthy fats, and rich in fruits, vegetables, and whole grains. And finally, get regular medical checkups. This allows your doctor to monitor your risk factors and catch any potential problems early. To wrap things up, let's quickly recap when to seek emergency help. If you or someone around you experiences a sudden onset of weakness or numbness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding speech, sudden trouble seeing, a sudden loss of balance or coordination, or a sudden, severe headache with no known cause, go to the hospital immediately. Don't hesitate. Every minute counts, and fast action can save a life and improve the chances of recovery. Thank you so much for watching and taking the time to learn about this important topic. Spreading this knowledge can make a real difference. If you found this video helpful, please give it a thumbs up and consider subscribing to the channel for more health content. Stay safe, stay informed, and we'll see you in the next video.